After marriage, most of the men are in their office behaving like a tiger, and at their home they become cats, and it is universally accepted truth. Now, the second type of the mouth ulcer after the traumatic ulcer are aphthous stomatitis. These are also termed recurrent aphthous stomatitis (RAS) or the canker sores, very common cause of the oral ulceration. 10 to 20% of the people suffer this non-contagious condition. These are of three types based on their appearance: minor, major, and herpetiform major. Minor are most common type. These are 1 to 6 small, about 2 to 4 millimeter diameter, round or oval in shape ulcers with a yellow gray color and an erythematous red halo. These heal with no scarring in 7 to 10 days. Ulcers recur at intervals of about 1 to 4 months. And here one can see the minor or the mild or Michaelis if the canker sores usually only form in these locations as one can see. These are the places where these canker sores can be seen. So these are the places of these are labeled as A, B, C, D. And here also one can appreciate that. And on this there are very common seen mostly in the children and others. The aphthous stomatitis, the major types are less common but produces more severe lesion and the symptom. These are larger, about more than 1 centimeter diameter, take longer time to heal, about 10 to 40 days sometime, and leave the scars also. The minor and the major subtypes produce lesion on the non-keratinized oral mucosa inside of the cheeks, lips, underneath the tongue, and the floor of the mouth mostly, but rarely on the keratinized mucosal surfaces, which are at the junction of the mucosa and out. Here one can see the major aphthous stomatitis as one can see the large ulcers on the palate and on the upper lip. These are the larger in size, usually more than 1 centimeter and more, and these are just here. Now, the other type of the stomatitis are the herpetiform ulceration. These are least common. It resembles the primary herpetic gingivostomatitis. It begins as small blisters, vesicles, which break down into 2 to 3 millimeter size ulcers. These appear in crops, coalesce, and unite to form larger areas of the ulceration. These cause extreme pain, heal with the scarring, and they recur frequently. Exact cause is unknown, but there is said to be some genetic predisposition seen. And here one can see the herpetiform after stomatitis, and these are larger and looks like herpes, so the name is herpetiform, but these are not the herpes and having no relation with the viral. After stomatitis, other possible causes include hematinic deficiency like folate, vitamin B or iron deficiency, smoking, stress, menstruation, trauma, and food allergies are also responsible. Hypersensitivity to sodium lauryl sulfate found in the toothpaste and the drugs like alendronate for osteoporosis, cytotoxic drugs, methotrexate, and non-steroidal anti-inflammatory drugs are also notorious. Similarly, nicorandil for angina, cocaine, and propylthiouracil for hyperthyroidism, used in hyperthyroidism, are responsible. So now the background of the canker sores, these are small painful ulcers form non-keratinized oral mucosa. These are, as one can see, the minor about less than 1 centimeter, major 2 to 3 centimeter, and herpetiform. These are the larger, and the sign and symptoms are, as one can see, that is about pinpoint papules gradually expands, well circumscribed, round, oval, yellow, gray, pseudomembranous center, inflammatory, red halo. These heals with, within 7 to 14 days, and the causes are weakened immune system, certain foods, as one can see, responsible, notorious chilies, and stress and menstrual cycle, nutritional deficiency, and the treatment is just manage the stress, healthy diet, and the oral hygiene. These are just the part of the treatment. Now, certain infectious causes of the oral ulceration are the viral ulceration are chickenpox, hand, foot, and mouth disease, herpangina, herpangina, herpetic stomatitis, human immunodeficiency virus, infectious mononucleosis. In case of the bacterial, acute necrotizing ulcerative gingivitis, gangrenous stomatitis, syphilis, and tuberculosis. In case of the fungal ulcer, blastomycosis, cryptococcosis, histoplasmosis, and paracoccidioidomycosis. And in case of the parasitic, the leishmania is notorious for causing. Similarly, the malignancy causing the oral cancer, having a persistent non-healing mouth ulcer, cancerous lesion due to the carcinomas, lymphomas, and sarcomas have been seen. Either tumor arises in mouth or involve the mouth from maxillary sinus, salivary glands, or the nasal cavities. Mostly these are squamous cell carcinoma. The main risk factor are smoking and alcohol intake, and the betel use are responsible for these kind of ulcers. Common sites of the malignancy are lower lip, floor of the mouth, under the tongue, and mandibular alveolar ridge. Typical malignant ulcer is red erythroplasia or red and white erythroleukoplakia. Malignant lesions are indurated, hardened, attached to the adjacent structure or to the base with punched out appearance and bleeds easily on the gentle manipulation. These ulcers persist for more than 3 weeks and making doubtful. Here one can see the shape of the malignant ulcer, deep indurated margins. And then vesiculobullous diseases. Some of the viral infections are classified as vesicobullous disease. Other vesicobullous diseases include pemphigus vulgaris, mucous membrane pemphigoid, bullous pemphigoid, dermatitis herpetiformis, linear IgA disease, and epidermolysis bullosa. And here these can be seen as the vesiculobullous disease. These are the vesicles, smaller in size, and these are the bulla, which are larger in size. It has been seen in pemphigus vulgaris and bullous pemphigoid, as one can see the ulcer which is being produced with the bulla, and so the disease these are called vesiculobullous disease. A beautiful wall painting made by some really genius painter, and it looks like that the wall is speaking, looking, and wall is alive. That is the beauty of the painter who have painted it. Now, the allergic reactions of the mouth and the lips may manifest as erosion, but not frank ulceration. Example is balsam of Peru, where persons affected experience stomatitis and the cheilitis, inflammation, rash, painful erosion of the lips, orophageal mucosa, or the angle of their mouth. And balsam of the Peru is used in foods and the drinks and flavoring in perfumes and toiletries for fragrance and in medicine and the pharmaceutical atoms for the healing property, and that is notorious for causing ulceration. The other causes are hematological causes, neutropenia, hypereosinophilic syndrome, leukemia, myelodysplastic syndrome, white cell dyscrasia, and gammopathies. Gastrointestinal causes include celiac disease, Crohn's disease, orofacial granulomatosis, and the ulcerative colitis. Similarly, dermatological causes include chronic ulcerative stomatitis, erythema multiforme, Steven-Johnson syndrome, angina bullosa, hemorrhagica, and lichen planus. Lupus erythematosus, Sweet syndrome, reactive arthritis, and Behçet's syndrome are also the other causes of mouth ulcer. Granulomatosis with polyangiitis, periarthritis nodosa, giant cell arthritis, diabetes, glucagonoma, these are also responsible. Then sarcoidosis and periodic fever, pharyngitis and adenitis, eosinophilic ulcer and necrotizing metaplasia, macroglossia and abnormally large tongue causes the ulceration. Caliber persistent artery, here a main artery branch extends into the superficial submucosa tissue without reduction of the diameter and behaving like an ulcer seen in the elderly people on the lip and cause ulceration. Now, the diagnosis of the mouth ulcer, medical history plus an oral examination, the duration of the lesion, the location, the number of the ulcer, size and the color is noted, hard to touch, bleeds or has a rolled edge, not healed within 2 to 3 weeks, rule out the possibility of oral cancer. An ulcer forming on the same site and then healing is due to the sharp surface. Ulcers that heal and then recur at the different sites are recurrent after stomatitis. The cause is unknown. Malignant ulcers are single and not multiple. Minor recurrent after stomatitis occurs on the non-keratinizing mucosa also. Major RAS occurs anywhere in mouth or oropharynx. Ulcer caused by the local trauma are painful to touch and sore. They have an irregular border with erythematous margin with yellow base. Ask history of the ulceration of the genital mucous membrane or the glands in the neck, lymphadenopathy, special investigation, blood test, vitamin deficiency, anemia, leukemia and diabetes is sometime there. A biopsy to rule out the cancer is done. Now, the differential diagnosis of the mouth ulcer due to the various factors like saliva, relative thinness of the oromucosa, trauma from teeth, chewing, etc., cold sore because of the herpes, vesicles and the bully form on the mucous membrane of the oral cavity are fragile, quickly break down to leave ulcer, as one can see, the canker sore, the angular cheilitis, and here again mouth ulcer and angular cheilitis. Angular cheilitis, a fungal candida infection at the mouth corner is seen. So consider these as the differential diagnosis. Here, the beauty of an artist making the tree to give the shape of a woman having the bow in the hand, and this is real the craftsmanship of a person who thought like this and made it like this. Now, the treatment of the mouth ulcer are symptomatic and cause related. Most ulcer heal automatically. Maintain good oral, oral hygiene, proper brushing after every meal, use of an antiseptic mouthwash or the spray like chlorhexidine to prevent secondary infection. A topical analgesic like benzidamine mouthwash may reduce the pain. Topical gels, cream, or inhalers, or systemic steroid to reduce inflammation. Avoid hot or spicy food and anti-inflammatories or the barrier paste to protect the raw areas in the mouth. And here one can have the chlorhexidine oral rinse and the benzidamine hydrochloride as rinse, and these are also available as the Maxius lozenges to give soothing. Antifungal drugs to prevent oral candidiasis for those who use prolonged steroid and prone to have the candida infection superheatedly. For recurrent ulcer, vitamin B12 is effective. Using a rinse of the salt water and the baking soda also help. Placing milk of magnesia on the mouth ulcer and covering the mouth ulcer with baking soda paste. Applying ice to canker sores. Placing damp tea bags on the mouth ulcer and trying natural remedies such as chamomile, chamomilla tea, echinacea, myrrh, and licorice root. Then chemical cautery is a very effective treatment which I do use at my clinic. And what is that? That we use the tincture iodine, putting on some swab and putting it there on the ulcer for 5 minutes, or we can use the cautery or the other silver nitrate and the other things just to have the chemical cautery of the ulcer by the different chemicals. And here the mouth ulcer, the different home remedies that can be used: coconut, clove oil, curd, and poppy seeds, honey, ice, and licorice roots that can be used for that. Now the prevention of the ulcer: rinse mouth with warm salt water a few times each day and brush after every meal. Avoid hot and spicy foods until ulcer heals. Avoiding food that irritate mouth, acidic fruit like pineapple, grapefruits, oranges, or lemon, nuts, chips, or anything spicy which can hurt and responsible for causing the mouth ulcer. Choose whole grains and the alkaline non-acidic fruits and vegetables, and avoid talking while chewing food to reduce accidental bites of the lips and the oral mucosa. Maintaining good oral hygiene by using dental floss daily and brushing after meals. Avoiding toothbrushes and the mouthwashes that contain sodium lauryl sulfate. Use wax to cover dental or orthodontic mouth devices for the sharp edge. Now, the summary of the mouth ulcer is: aphthous ulcers are mildly painful, annoying, and a few millimeter. These are a few millimeter across, as one can see. They heal in 7 to 10 days and no scarring. They recur usually 3 to 4 times a year. Then recurrent aphthous ulcers. These are many, recur monthly, childhood to age 40. These are seen. Then the major aphthous ulcers, lesions are more than 1 centimeter, more painfully recur very frequently, 10 to 30 days to heal, and they they do leave the scar sometime. Not herpetiform ulcers, these are not related to the herpes as the name is, but typically affects the female hip. These are many discrete ulcers, and these coalesce together into ulcerated patches, as one can see the small which collect together heal in 10 days, and these recur more frequently as compared to the other ulcer. So that was the summary of all the mouth ulcers which are responsible for causing the, and that is the end of the lecture. Hope so that you may have liked this lecture. If you have liked this lecture, please subscribe my channel and share it with the others, as it is very informative and I have tried to make it very comprehensive to cover every aspect of the mouth ulcer. And thank you very much to be with me, and once again thanks for watching my channel.